So in just a few seconds, we're about to see the Good Morning America segment that did one of the most fascinating stories on plastic surgery in a long time, which is to look at two different surgeons, two different surgery techniques, two different types of anesthesia on one set of twins. I think this is a fascinating opportunity to be able to evaluate if a 1 hour or 1.5 hour local anesthesia facelift can deliver powerful results or similar results, just like a more comprehensive face and neck lift that takes about 5 or 6 hours.
Identical twins who get plastic surgery at the same time, but they chose two very different types of facelifts. ABC's Cecilia Vega followed the twins who did just that and has their story.
49-year-old identical twins Mickey and Donna Keller are inseparable. They vacation together, even feel each other's pain.
When she broke her back in Spain, I felt it.
And now they're having facelifts together.
So what do you see wrong when you look at each other or you look at yourself and want to fix?
What I've noticed in the last couple of years was everything was sagging, like the neck. Like I would see pictures of myself, I'm like, oh my God. I care about how I look. I want to be attractive. I want to feel younger. I want to match my attitude, so to speak.
They are undergoing a kind of twin experiment. Donna is having a traditional 5-hour-long surgical facelift under anesthesia. Mickey, she's getting a facelift too, but her doctor is trying an experimental procedure. It only takes 1 hour and uses local anesthesia. She'll be wide awake for the whole thing. Mickey will get to go straight home. Donna will have to stay overnight in a recovery center.
The doctor will see me the next day and do the drains and do all this.
You don't look like a Martian.
That's okay.
I'm gonna bring my camera with a scrapbook.
It's the day of the surgery. Donna is having a facelift, an eye lift, fat injections, skin resurfacing, and Botox with Dr. Ashkan Ghavami. And Mickey, she's having a facelift, eye lift, skin resurfacing, and Botox. Remember, Mickey's awake. She even chats with us during the surgery.
Yeah, we're having a good time.
Weeks later, we meet up with them again. Will the twins still look alike? Here's Donna before and Donna after. She had the traditional facelift. Here's Mickey before and Mickey after. She had the newer awake facelift. And here they are together. While they still look like younger versions of themselves, these twins couldn't help but compare notes.
We were texting each other, snapping pictures of ourselves. Look at my neck. Okay, look at your neck. Our attitudes are so much more positive. We get compliments from our friends. They say that we haven't changed the way we look, we just look better.
For Good Morning America, Cecilia Vega, ABC News, Los Angeles.
Wow, I think they looked really good, and both women say they were pleased with how they looked as well. You can decide the difference, although, Lara, it's important to note the plastic surgery costs. They were dramatically different as well. The traditional facelift, $25,000. I know, a lot of money. And then the 1 hour experimental procedure is $12,000, half the price. But, ooh, we saw her awake for that.
Yeah.
That seemed a little scary. They look great,
the word experimental is always a red flag for me, but they do look great. And you could tell by the way they were walking.
Yeah, they had a little spring in their step.
They sure did. I saw a little something going on. Thank you so much, Amy.
The sagging here was addressed. The gland was addressed in my neck. I had puddles of skin right here. Yeah, like you could just grab like skin, it was puddles. And so he tightened that all up. And then my eyelids, he took out the extra fat. So I have my Japanesey kind of eyes and injected fat here. So it was this whole area that was, and then I have a shape of my face. Like my face was oblong and now it's more of a prettier feminine shape. He took out all this and gave you that the beautiful angle that you have when you're younger. I do.
This is what she looked like when she was younger.
Yeah. After the second, the second day, you forget, you forget about it because you can look, and even though I was swollen, I could tell the difference. My family members could tell the difference. If you look, she has more of a C. I have an L. You had still soreness with the jaw?
Yeah, I had soreness to open and close my mouth. like this. So I had to, you know, I just had to take it easy. And then I had the bruising.
Yeah, you had,
But
I
I
had
didn't really
no
have any
bruising.
swelling.
I had no bruising.
You can see her neck contour here. You can see the angle, and the distance from here to here tells you where the jawline comes to, because this is essentially her muscle, her thyroid, her cartilage, and this is how the jawline comes up. Here's her cheek contour and her cheek highlights, which I added fat transfer to. The depth that I went was underneath what's called the SMAS. The SMAS is a network of fibrous ligaments and fat that everybody has in their face. I actually went underneath that, on top and close to the deep muscles, to allow for a very strong pull and lift while reshaping with the fat transfer. All this produced this tight structure, which now has kind of relaxed in 3 months. And if you look at her from the front, you can see her jawline and her angle. And before she saw me, she was more squarish, rounder, and had a lot of fullness under here, which was hiding her jawline.
I love the results. I mean, it's like night and day. I mean, I'm a real joyful kind of person anyways, but I was never really social or out there. And now I feel like, you know, I can take my business to the next level. There's nothing that's stopping me. I don't feel shy about going out. I feel like I can just go anywhere.